bit. I apologize for that, but it is summer. So having lots of fun traveling and connecting with family and friends. It's been an incredible summer so far. Not liking or loving any of the headlines that I'm seeing. I actually am trying, honestly, not to turn the news on very much because I feel like it's always really bad news, but did turn it on today to see kind of all the things you guys are seeing, right? Mask mandates recommended by the CDC for schools. Many of the folks, both unvaccinated and vaccinated, coming down with the Delta variant. Reports now that even if you're vaccinated, you may be at risk for the Delta variant. I swear I wanted to come on here and not talk about COVID. Is that just not possible? I feel like every time I am ready to come on here, there's another COVID headline all over again. So we'll touch on COVID if you guys want to. I'm happy to answer any questions that you have. I wanted to talk about hormones. There are a ton of hormone studies out over the last 2 weeks. This is the stack that I have been carrying around of so many things that we need to talk about. And as I'm talking, I'm happy to take your questions and to kind of pose them to the group as well. And remember, this is a space for all of you. So I want you to feel welcome. I know we've got people in from all around the world as well. So welcome to my page. I usually do Tuesday night lives and take questions. Hadn't done the last few because I was traveling, but I'm back. So again, welcome, welcome, welcome. Let's dive in. I'm going to start with hormones and I'll backtrack into COVID. How's that? Well, there's been a lot of talk about hormones, and I don't know if you guys caught my Goop podcast that I did with Gwyneth Paltrow. I think that really touched a nerve. I've gotten so many comments and questions and all the stuff from folks that are just like, oh my gosh, this is me. I don't feel like myself. I'm a shadow of who I used to be. I don't feel good. I don't look good. I'm gaining weight. I'm getting in trouble in my relationships. And yes, our hormones are that powerful. They can absolutely change who we are and how we interact with everyone around us. So it's a really important topic. But not only do they change who we are, they can lead to disease. And that's the scariest part for all of us, right? And I talk so much about the importance of tracking and checking your hormones and really knowing where you stand at any given moment, because that's the way you know when you're getting into trouble. So for years now, my patients at Center Spring MD and I have been checking hormone levels and really looking to see where they might be going off track, where we might be missing things on our patients. But here's the thing, the labs are important, but so are screening studies looking at things like ultrasounds and thermograms to pick up inflammation, and even looking at your routine, mammograms every few years or so. Now, here's a classic example. I actually brought thermograms into Center Spring MD, and the reason I did is because we had a few cases where the labs looked beautiful, but the patient would develop some sort of hormone-based cancer or hormone-based illness. And I was like, there's got to be one more tool, one more way to figure out when something is going wrong. So we brought thermograms into the practice about a year ago, and thermography uses heat to detect areas of the body that are inflamed or might be at risk. And it's pretty fascinating because you'll see on a thermogram an area light up, and then as a clinician, well, hey, I need to chase that down. I need to investigate it and understand why that might be happening. So thermography is a valuable tool as well. So we're going to go into these studies about hormones, but before we do, and I don't want to be like the news, right, where it's all doom and gloom all the time. Before we do, I want to stress and emphasize that there is so much about hormone health that you can take into your own hands, into your own power. So let me go through some of these studies. Let me talk about prevention, and then I'm going to tell you my story with my own breast health and what happened recently. All right, you ready to hit this? So first of all, this is the one that caught my eye most recently. This was all about everyday chemicals, hormones, and breast cancer. What's the link? Who knows what the link is? It's pretty powerful stuff, guys, of chemicals. So this is a study that looked at chemicals. They looked at 296 chemicals that are causing an increase in estradiol and progesterone. Those are the two big female hormones, right? Both of those hormones regulate breast health and breast tissue. Now, here's what's happening. Of these chemicals, 71 of them, 71, caused an increase in estrogen and progesterone. These included chemical flame retardants, dyes, fungicides, and pesticides. Oh my gosh, pesticides are everywhere now. I feel like they're in our water, our air, everywhere we look. some of the chemicals, and again, these have really big names. I don't want to bore you to death with all the names of the different chemicals, but some of what they talked about are 1,2-diphenylhydrazine. Who's heard of that? Who can spell that? You get a prize. This is a chemical that manufacturers use in the production of dyes, pharmaceuticals, and hydrogen peroxide. Malathion, I'm probably saying that wrong. That's an insecticide. It's found in a chemical family called organophosphates. Organophosphates are another family of chemicals that we see over and over implicated in all kinds of hormone kind of conditions and diseases. Phosmet, this is an organophosphate as well. This is also involved in sort of breast cancer and breast health too. And the last one is I can't say these words today. I'm like stumbling over my words. Oxyflorpin. This is an herbicide with widespread use in agriculture, specifically for weed control. So in this study, they used data produced by the EPA, right, the Environmental Protection Agency, to really look at commonly identified chemicals and understand how they are implicating breast health, specifically hormone receptor positive breast cancer, HR positive breast cancer. So how many of you know somebody with breast cancer? You may have somebody in the family with breast cancer. I bet you have a friend, a neighbor, somebody. And what are you usually told, right? I posted a video about this earlier this week where we're usually told it's genetic, it runs in your family, there's nothing you can do about it. Well, I am here to show and tell you that that couldn't be further from the truth. We know that there is a chemical link to breast cancer, and we're seeing more and more of it day in and day out. So what are you supposed to do? Well, we've really got to pay attention to your toxic load. What are you eating? What are you drinking? What are you doing in terms of your body care and skin care? How are you taking care of your liver? The liver, guys, is the laundromat of the body. And if we're not taking care of the liver, then we're going to increase our toxic load. We're going to build up a lot of these chemicals in our system, and that in turn increases our risk for hormone-based diseases, including hormone-positive receptor breast cancer. So such an important topic to latch onto. And I feel like we are still not, we hear about it, we talk about toxicity a lot, we talk about breast cancer over here a lot, but they're linked. And this is one of the first studies that truly link it and really kind of give rise or give question to the fact that this is a big deal. And if we don't pay attention to this stuff, we're going to continue to see the rates of breast cancer go up in women, no matter how sophisticated and fancy we get with screening. All right, studies in the past suggested that inhibiting or reducing estradiol was effective in preventing or treating breast cancer. In one trial, they found that HRT, when they used synthetic forms of progesterone, that actually found to increase breast cancer risk. But what they're trying to understand is it the progesterone that's synthetic, or is it the chemicals in the synthetic progesterone that are actually responsible for breast cancer? So think about it. For so long, so many women are afraid of hormone therapy, right? They're terrified of hormone therapy. They think they're going to get breast cancer. But now this is actually saying, well, wait, is it the hormone, or is it all the chemicals that are going into making synthetic hormone that is actually more of the issue? Lots more coming out on this, and kind of the link between our toxic load and breast cancer, and how our DNA, as it's damaged over the years and as we live our lives, is very much reflected in the health of our breasts. So let's go back to this idea of the liver before we walk away from this study. So the liver, again, being the laundromat, what is going to protect the liver and really help to manage these estrogens, or the dirty estrogen, as I call it? Well, first of all, anything that is burdening the liver is going to be problematic, right? So drinking alcohol, so excessive alcohol intake is going to wear the liver down, is also going to make it difficult for the liver to do its job to eliminate the environmental toxins. So that's one factor that everybody can control. Really watch your alcohol intake. I think the second factor that we can control is sugar, right? Where is insulin and glucose all produced? It's actually produced from the liver. The liver regulates kind of what's going on with insulin in response to your blood sugar levels. So when you have a high sugar diet, or a diet in refined carbohydrates, right, the white diet, then we know that you're going to have higher insulin levels. It's going to be harder on the liver, and the liver won't be able to do its job of filtering environmental toxins. So really watching sugar. And then after that, I talk about all these liver supporters, right? So things like green smoothies that clean up the liver, increasing your fiber helps clean up the liver as well. We know that a lot of herbs like dandelion root or even milk thistle help to support and clean up the liver too. So all of these are intricately involved in liver cleanup and really helping to keep our livers happy, which keeps our estrogen happy. All right, I'm going to share a personal story now. That's not 100% over, but I still think I would be hypocritical to not share the story. So I'll be totally honest. I found a lump back in January in one of my breasts. And of course, the first thing your brain goes to, right, is something's wrong with me. I have cancer. But in the journey of trying to figure out what it is, it's okay. It's just a benign tumor that needs to be removed. But in that journey, here's the fascinating part of that story is that once I found it, and I know why it's there, I was super stressed between the pandemic and the year prior to the pandemic. There were a lot of changes for me. Vic had a heart attack, remember, in 2019. I have a 13-year-old daughter, and there were a lot of issues there. There were a lot of issues in my company, just stress. And there were moments that I wasn't really taking a really good care of myself. And so I know why the lump is there. And because I also at times neglected my health and my stress, remember, gets stored in the liver. It's a Chinese medicine concept. They talk about it over and over again. And so sure enough, fast forward a year later, I find a lump, and the lump is benign. There's nothing wrong with it. But here's the interesting part of the story. The journey to understanding what it was and getting some of the biopsies was about a 3 to 4 month journey. Once I found it, I put myself on a regimen of trying to clean up dirty estrogen. So that included doing green smoothies, really increasing my fiber because I had gotten pretty slack about my fiber, being consistent with my methylated B vitamins, and then also adding something called calcium glucarate. Calcium glucarate also helps to clean up dirty estrogen, helps support the liver. And by adding all of those in, when I went back in for a repeat scan, they were like, what have you been doing? All the angriness in your breast has calmed down quite a bit. It looks so much better. So I tell you the story only to remind you that we are in control and that there is so much that we can do to protect our health, to protect our liver health, our breast health, even when we're in an environment that is toxic, increasingly toxic, and our toxic load is so connected to what's happening with our overall health. Okay, so that's a whole long spiel on that. There are a couple of questions. Let me make sure I get those. Supplements for the liver. I do like them, and sometimes they're easier to do than boiling herbs, right? And making your own little teas. So the supplements I typically like for the liver are milk thistle. So 200 milligrams a day is what I usually recommend. Dandelion root is another one that's really great. I just mentioned calcium glucarate. That's one that's excellent as well. And then glutathione. And glutathione, remember, you can do orally as NAC, which is N-acetylcysteine. And then you can also do it in IV or injectable form as well. And it does help to clean up and detox the liver. A great strategy, that I tell so many people is that if you do have a weaker liver or hormone positive type conditions, liver cleanup is always a good idea. Doing a liver detox, doing a glutathione IV maybe once a month to really help support the liver and clean it out. These are all things that you can do for liver support. All right, let's hit, I think there was one more question. The great question. All right, someone asked about synthetic versus bioidentical hormones. What's the difference? So synthetic hormones are typically sort of man-made. They're made in a laboratory. They're compounded together. They've got a lot of different chemicals, preservative additives on them. They don't necessarily mimic the way our own natural hormones work. Bioidentical hormones are mimicking the structure of our own hormones. So the body doesn't see it as foreign. So for example, in the olden days when they used Premarin as the estrogen source, the body recognized that as a foreign source of estrogen. On the other hand, when you're doing something that's bioidentical, it's working with the body. It's not necessarily taking everything over. And in that sense, it's not seen as a foreigner in the body or an invader in the body. Is something that's working with the body. So bioidentical hormones we use a lot. They're sometimes derived from yam is the most common form. Sometimes it's from soy, but basically you can microdose them in very tiny amounts, enough to give symptom relief, enough to balance these estrogen to progesterone ratios, and in turn help you, first of all, feel better if you're going through perimenopause and menopause, but also not cause this liver buildup, toxicity buildup that we're seeing with some of the synthetic hormones. So that's the difference between the two. So your birth control pill, for example, is synthetic. A bioidentical cream, again, that's bioidentical. So there's some differences, and any of the doctors that work with hormones over and over again, we talk about bioidenticals versus synthetics all the time. Now, in the pharmaceutical world, many of the current hormones that are being put out are actually a little bit more bioidentical than what they used to be in the past or what was used in the WHI or the Women's Health Initiative. So hopefully that answers that question. Let's see if there are any more. Very low T3 and T4 levels. What do you recommend to support these? All right, when your T3 and T4 is low and maybe your TSH is either overcorrected, then more than likely you are having an issue with absorption. You're having a gut issue. You're having problems absorbing nutrients. And so the first place I would begin would be to work on your gut health. So do you have leaky gut? Are you having an issue with bloating, constipation, diarrhea? A lot of that is the reason why T3 and T4 will stay low, even if you're still on thyroid hormone. It's just not getting absorbed. The second reason, often with thyroid, if you're not absorbing thyroid hormone, is that you don't have the nutrients, right? You don't have either enough iron or selenium on board, or you don't have the enzymes on board to convert T3 to T4 and really help those levels to come back up. Or again, you're just on the wrong form of thyroid medication. So if you're on a form of thyroid medication that's not working for you, you will continue to see T3 and T4 low, despite like constantly manipulating and playing with the doses. So keep that. Oh, you've got SIBO. There we go. See, there's the answer. Yeah, every time I see thyroid numbers look wonky or look like they don't make sense beyond just like, okay, you need more, you need less, it's usually the gut. I see that nine times out of 10. And the other sort of little minority is what it'll be sometimes heavy metals, candida. My connection's bad. Candida sometimes will be an issue too, but 9 times out of 10, it's something going on with the gut, the microbiome of the gut, or it's the absorption or the gut lining, but something's going on there. Okay, so we got that. Let's see if there's any other questions. I want to just talk about one or two. Time flies on these things, goodness. All right, I want to talk about one more hormone issue. Any of you have PCOS, polycystic ovarian syndrome? Raise your hand. All right, PCOS. Here's a study that came out recently as well. This study talked about PCOS. And here's my pet peeve. So I have all these pet peeves about hormones, right? So my pet peeve about, breast cancer is that we always talk about it in the context of family history. My pet peeve about PCOS is we always talk about it in the context of getting pregnant and think it's a 20 or 30 something old disease. That's simply not true. PCOS is more and more becoming recognized as a metabolic condition, a metabolic illness where there's really an adolescent, a 20s, 30s, 40s, 50s, even a menopausal, postmenopausal version of it. This study is talking about it. It's talking about the influence of PCOS on bone health. And essentially what they're finding here is that PCOS, especially, and they studied some different populations, and they're saying there was a huge connection between bone loss and polycystic ovarian syndrome, or increased incidence of osteopenia. Now, for me, again, that makes sense because guess where all these hormone conditions come from? They come from the gut. So if we know the gut's not working well, you're not absorbing nutrients, you're going to have more bone turnover. You can absorb that C and D and all these other things you take for bone health, and you will have a higher incidence of osteopenia. So important to remember that PCOS is not just a disease for somebody in their 20s or 30s or someone trying to get pregnant. There are many different versions of it. It is a metabolic disease that affects almost every aspect of health. It affects everything from bone health to cognition to energy and so much more. I actually think it probably needs a name change, and it's more of an autoimmune disease. I posted a video last week talking about the connection between PCOS and ADD or ADHD and how that inflammatory spectrum that I'm seeing in young girls, I'm also seeing a lot of ADHD and ADD in those girls. And I think that's due to neuroinflammation. So the same forces that are messing up this gut hormone connection, this very intricate connection and bond, are in turn creating a problem with the gut-brain connection. And that's why we're seeing more ADD and more ADHD in people with PCOS. And again, if that's you, you know what I'm talking about, but I've seen it firsthand here at home. And then of course, definitely with my patients as well. All right, let's see. Let's switch. Men's health. Let's talk a little bit about the men out there. I promise I don't want to ignore you guys. There's just so much to talk about with women that I feel like you guys are an afterthought. So I'm so sorry, but men's health is important too. And men are also, struggling with many of these same issues. We're seeing higher estrogen levels in men. They're storing estrogen. Their testosterone levels are going down dramatically. The sperm count across the globe is going down. Again, this would probably take us right back to this toxic load study we just talked about, right? Toxicity is affecting All of us. It's affecting our hormone axis. And if we really wanted to dial it all the way back, it might be that it's the pesticide, it's glyphosate that's really responsible for what's happening with everybody's hormones. But let's get to the question. I'm 58 years young. What do you recommend for older men's health, like memory loss, energy loss, testosterone, and the immune system? I have a very boring answer for you, Richie. I recommend that you begin with your gut health. If you start with the gut and really get on the right diet for you, an anti-inflammatory diet, very low in sugar, low in refined carbohydrates, getting enough protein in, and then really making sure you're digesting everything, then that is the place to start. Because again, that's your manufacturing hub. That's ground zero for so many things, including the manufacturing of your hormones. That's also where your immune system lives. That's where your nutrients get absorbed from. So what you need for memory and energy are things like high doses of B vitamins, vitamin D. You definitely want to have adequate levels of testosterone on board, zinc, which helps testosterone, magnesium. All of these things really help with so many aspects of health. With heart health too, it does go back to diet, and it goes back to the concept of inflammation. Most inflammation begins right here in the belly. So for men too, really watching gut health, understanding where your estrogen levels are, where your estrogen, testosterone, all these hormones are, is so important for overall health. So hopefully that's a good quick answer, at least, to talking about men's health, but that's another one that we could talk about for a very long period of time. All right, let's see. If there are no other questions today, I'm going to move off hormones for just a minute and talk quickly about COVID. How are you guys feeling about COVID? Everybody okay? So new mask mandates came out today here in the United States. Delta variant high in certain regions of the country. In those particular regions, the CDC is saying for everybody going back to school, they need to be in mask. And I don't know how you feel about that. I know our kids are over it and they are tired of it. But here's the thing, at least if they can go to school, I think that's an improvement from last year and everything that so many of us went through last year with kids trying to do online school, which I just think was a complete disaster. So anyhow, that was out. The Delta variant cases going up here in the United States. What am I going to talk about? Your immune system. Please, please, please continue to protect and watch your immune system. We know your immune system matters. Really take care of things like your gut health, which we just discussed. Up your levels of vitamin C, D, zinc. Astragalus is one of my favorite things in the world. Get on astragalus if you have a weaker immune system. If you're starting to feel bad, make sure you take it at least 3 times a day. It helps to decrease the viral load, ups your T-cell immunity response, and helps you to not succumb to any virus out there. So really watch your immune system. If you want to learn more about how to take care of your immune system, remember that I've got an immune course on my website. Go to drtaz.com and go to courses, and you'll see the immune course there. There's also an immune guide that we send out if you join the tribe. So we'll send that out as well. But lots of good resources for you. Join my tribe, by the way, guys. We send out guides and recipes, and you can join my private Facebook group and discounts to everything on my products on the East West Way shop. So lots and lots of fun stuff there. So check it out and become a part of the tribe, and we will all work together to keep you guys super powered and answer your questions and make sure that we're navigating all the health information adequately, right? My passion, my mission is to merge these systems of medicine to get answers for everybody so that we're not bouncing around the healthcare system, but at the same time, you really find the formula for you. You really understand how to take care of you as you navigate research and studies and so many other things. All right. So last thought, long COVID syndrome. Long COVID, seeing a lot of it in the clinic. Remember, the early signs of long COVID are a lot of rheumatological signs, a lot of inflammation, brain fog, forgetting, cognitive distress, shortness of breath, chest pain, a lot of that lasting a really long time after you've had the initial hit of COVID. So I want to remind you guys that if you start to feel bad, start your immune protocol right away. If we can punch this thing out on that first hit so it doesn't become a more chronic issue, then we're going to be ahead of the game. So keep in mind, long COVID syndrome, if you've got any of these recurrent symptoms after the vaccine or after getting COVID, either one, where you're brain fogged, fatigued, you're starting to get joint pain again, you're having weird hormonal symptoms, or you just feel tired all the time, then remember you might be developing some version of long COVID that needs an anti-inflammatory diet, needs an anti-inflammatory response so that it can be handled adequately. All right. So I'll leave you with that. If there are no other questions, I hope you guys have a great rest of the week. Remember, you can DM me at any time and send your questions in. I'll tackle them on these lives or tackle them in person as well. But happy to answer questions, continue to build and create this tribe, and check out all the great things in the week ahead. We've got an amazing podcast episode that I'll be posting tomorrow. It is actually, this one gives me chills for very selfish reasons. I got into holistic medicine. One of the first things I did when I had my issues was take a weekend course, believe it or not, in holistic medicine, which at the time, this was a long time ago, but at the time was hosted by, I think it was the AHMA, which was the American Holistic Medical Association. But the father of holistic medicine is on my podcast tomorrow, Dr. Norman Shealy. I don't know if you guys have ever watched any of his stuff, but he is fascinating, and he is 88 years old and still kind of tinkering and still talking about medicine and healing and all his theories. So definitely check that episode of the podcast out. Remember, it's on Apple, iTunes, and Spotify, and everywhere that we've got podcasts. The name of it is Superwoman Wellness. And then on YouTube, we've got a new video every week. So check out the latest videos. We're talking hormones, we're talking recipes, all kinds of great resources for you guys. So check out my YouTube channel as well. All right. Hope you have a great rest of the week. I'll stop blubbering away over here, and I will see you guys. Well, I see you. So next week I am out of town again, I believe. So we'll see you maybe in about a week and a half. Schools will be starting. We'll talk back to school, how to get you guys ready. Until then, stay healthy, stay well, stay super powered, and I will talk to you soon. Take care.